my dissertation committee.
Oh, okay. Well,
So he was an anthropologist.
yes.
Officially.
Yes. So I was attached to the hip on him, but I never had him on my dissertation committee. And so he taught us all about culture change from his lens in his classes. So between Castle, Tyroler, Patrick, Sherman, Ed, and Bert.
Certainly, yeah.
What a base.
Yeah, because Bert was officially a sociologist,
Correct.
but he did his dissertation on anthropology.
That's right. Who cares? Does it really matter? So, and to have all these lenses in from all these years of experience, I don't know if the students did we understand it then? The richness of the people who we were being trained by? I just don't know if we realized it then.
How could one?
I don't think
I
we
certainly
could.
didn't when I came along.
I didn't, and it was only till subsequently that I said, oh my God, I had such an experience here, and so much of it remains as threads in my career that I can't imagine where else I could have been to start my career. And I also can't imagine how I could evoke this energy and enthusiasm in the field without the tentacles in from these people of the stories. So the stories that they evoked from the field were so much a part of what I remember. And Castle's lectures were ultimately typed up. Remember that?
In fact, when I took it in '72, my recollection is that the first thing we did was receive for free a transcript of his lectures.
That's right.
And I still have them.
So do I. Well, there you go. But they're gems.
Yes.
They're gems, and they tell you, and I read to students from them as if this is the tome of culture, change, and health. And maybe it is. Maybe because he never wrote the book that he should have written. That those of us who keep these tomes and pass them on to our students are creating the legacy of John Castle in that way. I simply don't know, but I don't try to at this point. Yet the idea that you can go into a field setting in another country and suddenly find an analog to you, trained by a friend of John's, was incredible. The other one who was incredible was Cecil Sloan. So the story with Cecil Sloan, who was a very different personality, don't you think, than the others. The others were cut from a certain grain. And then there was Cecil. And he was the broadcaster, though, I thought, to the world about much of the research that was going on here. And the reason why I say this is that my thesis on smoking and lung cancer mortality in North Carolina, he actually asked Al and I if it was okay to use my slides for dissemination to the healthcare units across North Carolina. And he was involved in all these healthcare assessments in different clinics in North Carolina. And I actually think he took a lot of the information and the data that we generated about North Carolina for North Carolinians and disseminated it. That was my view of him. He went to churches, he went to the clinics, he just kept saying, I'm going to move this along. We need to know this information, and we need to get it out to the community. So he was the epitome to me of community engagement.
And I was not aware of that. But I know he was involved with primary care practices.
Right, and who was starting the hypertension studies in the churches? Was it Cecil Sloan, Sherman James, a combination of them? I don't know, but I remember that niche as well as part of my experiences here. And how the churches were the way to get African Americans to get their blood pressure measured and to
Now, was John Hatch involved in that? Do you remember?
Oh, he could have been. He could have been.
Because he was heavily involved with the Baptist Church,
Right.
Baptist State Convention, I think.
So I don't know, but I remember that as another thread coming through on my experiences here. Just seeing that all evolving, and then of course Evans County was another major thread where Tecumseh was going on in Michigan, and Framingham in Massachusetts. So there were threads coming out through the era that we were students that remain to this day as actually, I think, bulwarks of epidemiology, if you think about it, because so many of these studies led the way to other research that was really critical, and I think was cutting edge for the time.
Oh, certainly.
Yeah.
Certainly.
So those are some of my impressions of being a student here. I think that it was an unusual time, particularly for women. I don't know what my cohort would say. I haven't asked them about that exact question.
It'd be great to get a reunion sometime.
I was talking with Stephanie and Till Sturmer last night about that. I was talking to them about generating a reunion for us because the department needs support, and the bits of money that each one of us gives, and we all know we do because we keep in touch with each other, may not be as meaningful as if someone could corral us as a group in a room and say, would you support and endow this or that or whatever? And would you join forces like this to help the department in different ways? Because we're all challenged. Being at Purdue now, the academic framework for teaching and for training the next generation is shifting gears. It's very politically based because legislatures are not supporting land-grant and public universities like UNC or Purdue like they used to, and we all know this. And we know that the lens is on the number of students enrolled at the undergraduate level, so we're starting a public health, we have a public health undergraduate program, we're revving it up.
That's all, you're teaching in it.
Yes, exactly, and I'd imagine that would generate more funds, but it tilts your lens of of the whole school in a different way.
Yeah.
So we're in a very big transitional phase, I think, for public health. I think students who are undergraduates can easily learn public health. I don't think anyone disagrees with that at all. And even maybe in high school.
So, yeah, David Kleinbaum, whom I saw a week ago, is really trying to provide epidemiology instruction in high schools now.
Yes, I keep up with him, and he has told me about this. I keep up with Sherman. So I see Sherman in Atlanta because my son David lives in Atlanta.
But Sherman is now on leave in Palo Alto.
Oh, he is?
At Stanford, yeah.
Oh, that's
for
nice.
A year.
Well, he gets around.
He does.
He was at Emory for a couple of years,
He
and
was,
I've seen him when he was at Emory. And then I see David a lot when I am in Atlanta because he trained me in statistics, and he trained my son David in statistics. So we're an intergenerational family for him.
So you know I have a recorded interview with David Kleinbaum.
Yes.
Where Bill Jenkins was the interviewer.
Oh, no.
Yeah, that's online.
Oh, my goodness. So there you go. So I don't know what else you...
So I want to go back a little bit to catch up a little bit about your career getting to epidemiology, because you went through it really quickly.
Right.
And just to make sure I'm understanding. So you went to high school in...
Long Beach.
Long Beach. What was the high school? Just for
Long Beach High School.
Long Beach High School, okay.
Yep.
And then you went to Rutgers?
I went actually to Boston University to an honors program. And it was a 2-year program, and at the end of that, you could shift into a number of the Boston University programs. And that was at the end of that where we had this aptitude exam. What's your specialty area? And that's where Mr. Smart sat me down and said, "You're not going to believe this, Michelle, but you really should be in STEM."
but wait a minute, you went to Boston University for college?
2 years. For 2 years for college. And then I transferred to Rutgers.
But they have STEM at Boston University, don't they?
They do. But after I talked with Mr. Smart about my career, he said Boston University wasn't going to make the mix.
Really?
For me. I needed a more he was using the terms interdisciplinary in 1969.
As an undergraduate? He was telling you that?
Yes, this is what because he said, "You're interested in psychology. I know this, you're interested in social sciences, but honestly, your aptitude's here. So how are you going to do this?" And so we looked at different colleges, and he said, "I think you should apply to Rutgers." I was out-of-state student for Rutgers, because it has an anthropology department, and the anthropology department is tied to the medical school, which was unusual, to a primate colony, which was unusual, and to other STEM. And so he said, "I think that'll be a better place for you than staying at Boston U."
That's extremely unusual, isn't it?
It was extremely unusual to tell me this. My parents were ecstatic because it was half the price, and I got in. And I got this unusual training in primatology and in biological anthropology there, which I would not have done. They were way ahead of their time at Rutgers in this. I took anatomy in the medical school at the time as an undergraduate, and this is my senior year. So I came in with this very crazy interdisciplinary background that Bert immediately grabbed up. He was so clever and so unassuming. And that's how that all started out.
So 2 years in Boston University, then 2 years at Rutgers.
And then I graduated and immediately came here.
And so you came here because you had this interview here.
That's
but
correct.
What led to that? How did you?
So I actually had intentions to go to Stanford. I'd gotten into Stanford. I go to Stanford. The wise thing was my advisor, Jane Lancaster,
At
at Rutgers said, look, Michelle, you better interview and see whether you like these places. I go out to California to Stanford. And the fellow who I'm supposed to train under says, I'm leaving. And I went, oh, you're leaving? Okay. Well, that was worth a trip to California.
They have phone. I guess they didn't.
So I came down here because of the medical anthropology program, which also caught my fancy. And so then Tony McMichael invited
Tony
me in.
McMichael was a visiting scholar, wasn't he?
No, he was in the anthropology department.
Because-
Oh, not Tony McMichael. It's Tony. Tony McMichael was a visiting scholar here. Tony, what was it? Michaels. It was not McMichael. He was the anthropologist.
Oh,
I'm
so
sorry.
before when you said Tony McMichael, it was Tony Michaels.
Yes,
Okay.
the anthropologist here. Sorry about that.
That's okay.
Because Tony McMichael was another one who I played flute with him. They were
Really?
crazy. Yeah, they were with him when he was here and with David Kleinbaum.
Uh-huh.
So there's so many different threads of environment, socializing, and learning here.
Did you perform with Barbara Hulka also, by the way?
No.
No, okay.
No. But that all just was intertwined in your life here as a student. So I came down here, just to get back to the thread on my training. I came down here because of the medical anthropology program, and first walked into the anthropology offices, great anthropology program, by the way, and then had this one interview with Bert here, and that started it all. That was Bert.
Wow.
Yes.
And that was, let's see.
1972, spring of 72.
Spring of 72.
Correct.
Okay, because you'd already applied.
I'd already applied.
And then you were admitted, and then you started in fall of 72.
And found I wasn't going to go to Stanford. And so, and this was great. The other part that I loved was the weather.
Yes.
Didn't we all?
Stanford's pretty good there, too, I think.
Yeah. But I was a tennis player, and
Oh, my goodness, also.
So it was great. I played tennis in the morning with Margaret. What was the student, Margaret? There was a doctoral student who was a nurse, and she came here with her children. She was a widow, and she came with her children to get her PhD. And Margaret and I would play tennis in the morning before we went to classes. Yeah.
Wow.
Yeah. So much happened in this short period of time. I was here about 4.5, 5 years. That was it.
So when I was a student, we used to have these picnics.
Right?
And I remember Michelle Ibrahim playing volleyball at some.
Oh, okay.
I don't know what happened in the mid-70s.
We did not have picnics. We had these smaller events going on at different people's homes. It was much more intimate at that period of time.
How many students were in your
My cohort?
mentored, say, for example? Yeah.
I had headed out of the Heights.
As a student?
Yes. And this Turkish woman, medical doctor, brilliant woman, Betsy Togut, and I, and one fellow, Robert Holbrook. That was us.
Only 5 of you?
I think there were only 5 of us. Here comes Gerardo right now. And I could be corrected by him. Come on in. Gerardo, how many were in our cohort in training here? I have Holbrook, Togut, you and I, and
Just get you on camera.
how are you? Good to see you. Good to see you.
Good to see you. Your memory is much better than mine. That's for sure.
And this Turkish woman who was a medical doctor, who was brilliant, who was here as well. I can only think of 5 of us.
This was a very small group.
You see?
That's such change. Such a change. There were 20 entering. No, you're talking about just doctoral students, right?
Yes.
Yes.
How many master's students also?
I have no idea.
I can't remember that. I can't either. So there you
We
go.
didn't mingle.
We didn't. You're right. We didn't mingle.
See you
See
shortly.
you later. Okay. Well, there you go.
So,
So there were 5 of us.
I've been trying to get Gerardo on camera for years, so this
So
was
you got-
really fortuitous.
So, and I think it was the first year or so of the environmental epi program, according to Stephanie. So maybe that was what catapulted
Well, that
the
would have
number
been part
of.
of it. My year, there were 20 students, but a lot of them were MPH students,
Okay.
physicians who were,
Right,
and that may have been one of the reasons it was more male that
Yes.
year also.
or maybe. So that was us. That was it.
Wow.
Yes.
Now, who was your registrar in the department? there?
Harry Barr. Was it Harry Barr who was the registrar in the department?
So Joyce Allen was the registrar when I came in '77.
Ooh.
And I'm
It might have
wondering
been
if-
Joyce. It might have been Joyce.
Harriet was in the dean's office then, I think, or
She might have
was in
moved to
health
the dean's
education.
office. Yes, yes.
She was in health education.
It
No,
was
actually, no,
Joyce.
she was. Yeah, Harry Barr was in health education in the early '70s
Okay.
when I came.
So it must have been Joyce.
Okay,
And I can't remember any.
and she had an office right across from the student room,
Yes.
the big Epi student room.
That's right. That's right. And we all dragged our big key punch cards in our
Yes, why don't you talk
dissertations.
about your computing a little bit, because people out there, they think that computing are these smartphones.
Right.
and-
What did we do? We